Hello and welcome to ETX Covered. I'm David Littman. Healthcare has been one of the most important parts of life this past year, but it might be the only one in which the buyer often doesn't know how much they'll pay for a product. That was supposed to change when President Donald Trump signed a hospital price transparency rule in 2019. Hospitals would have to list the price of common tests and procedures so patients could shop for the best value. But healthcare experts say consumers are suffering because hospitals aren't compliant. And we're joined now by David Balat, a healthcare analyst for the Texas Public Policy Foundation. David, thank you for being here.
I appreciate it. Thank you. Good morning to you.
It's hard to argue that transparency in pricing is a bad thing. So is the system we have a good way of going about it?
The one that we currently have is completely opaque, meaning you cannot see the real prices in healthcare. So no, absolutely not. People say that the free market hasn't worked. Well, we don't really have one because if you don't have prices, you don't have a free market.
The Texas Public Policy Foundation has a price transparency compliance index. It shows that fewer than half of the hospitals in Texas have posted their prices, and that puts us smack in the middle as far as the state rankings go. So does that number surprise you?
Yes and no. I expected them. They fought pretty hard. They fought the order fairly hard, took it to federal court, took it to appeals court, lost both times, and have really been pushing back because they benefit from all the consolidation that's been happening around the country. And with that consolidation, they've been able to use their market power to raise their prices. So their prices are quite nice for them, but not necessarily for patients.
David, give me an example of what this actually means for a patient, how it affects them.
Absolutely. You know, let's go back to let's talk about a patient that may need a CAT scan. And if let's use me as the person in this scenario. If I have a major insurer, say Aetna, and I have two hospitals in my town that are in the network for Aetna, and one hospital is part of a big network, a big system, and they're able to negotiate a CAT scan for $2,000, whereas Hospital B over here is just a one-off hospital. They're on their own, and they're only able to negotiate $1,000 for the CAT scan. If I have a $5,000 deductible, where am I going to go? If I'm responsible for the first $5,000, I'm going to go to the one that's going to save me $1,000. Quality being equivalent. I'm gonna look out for my own self-interest.
And in the spirit of fairness, is there that complicated a wealth of data that would make it difficult for a hospital to be able to post the true price of its procedures and tests?
Well, I think that's coming. It's still so soon that there are a lot of companies that are trying to take that data and make sense of it.
This idea of price transparency, it's probably a two-part issue, right? You have someone who has an emergency. Well, they don't have time to be shopping around. They need help right then. But if you have someone who knows they have a procedure they want to do at some point or knows they have a test they need to get done, how easy is it to go to a hospital's website? Let's say in the Tyler area, we have UT Health East Texas and Christus Trinity Mother Francis being the big ones. How easy is it to go to their website and find their prices?
Christus would be very difficult because they've just refused to be transparent whatsoever. But it really is just, it can be challenging. And we have to rely on some companies that have come out to produce some tools that would help us out. But back to what you were saying, this isn't meant for emergency or emergent type of care. This is for the 80% of healthcare that is schedulable, if I can use a word I just made up. But you think in terms of CAT scans, MRIs, labs, you can absolutely shop for the price that is best. And we've created a tool here at the foundation. If you go to our website at texaspolicy.com/shopping list, and there are going to be a number of links there that will allow for you to find transparent providers, whether it be for surgery or labs or pharmacy or a physician's practice. So they're out there. It's available. You can get affordable, good quality services in healthcare. It's just a matter of having a look.
So does the onus fall more on Washington or on the state legislature as far as getting a fix and getting more of these hospitals on board?
You know, it would be great if Washington were more involved. It would be great if Washington were more involved. I'd love to see the executive order codified into law because, as you know, executive orders come and go at the whim of a president. Now, President Biden has expressed support for transparency. His nominee for Health and Human Services, Becerra, has expressed support for hospital price transparency. And that's all well and good, but right now the order is insufficient because the penalties are so low, which is why you see very few that are actually complying with the order. But yes, in Texas, we're looking to do things where the federal government has failed, and we have bills in both the House and in the Senate that mimic much of the language in that order, and in some of the cases have much more stringent penalties.
But since so many healthcare providers do work across state lines, if Texas were to increase its penalties, would that have an effect on the rest of the country?
I think other states would fall behind Texas. Texas is a national leader when it comes to policy, so people do look at what we do here in the state, and that's a good policy. That's very popular. Healthcare price transparency. When you look at the polling, 9 in 10 Americans are in support of seeing the prices. That's truly bipartisan. It's not a matter of one party over the other. It's affordability in healthcare, which is the number one issue in healthcare that people are most concerned about. So I think if we show and we have some success in getting those bills passed into law, then absolutely you'll see other states fall in line.
And then on the flip side, if there is no action in Washington, if nothing happens in Austin, do you think that more hospitals would provide that information on their own, or have we hit the level of what patients can expect?
I do believe that the real change will happen when individuals and employers, especially larger employers, really set the tone for what it is that they want. Unfortunately, employers that offer health insurance are in the healthcare business. It's a significant line item on their budget. And if they're going to continue to pay out those kinds of dollars, they need to be involved in the decision making, and working with those hospitals to reduce those prices is going to be part of that equation.
Well, David, thanks so much for being with us today.
Oh, it's my pleasure. Thank you for having me on.